Hi, I'm Dr. Emily Sonnenblick. I'm one of the breast imagers at the Dubin Breast Center at Mount Sinai. So women should know that having the COVID vaccine or any vaccine has no implications on their overall breast health. We have been seeing swollen lymph nodes in the armpits of women who have had recent COVID vaccines, however. So lymph node swelling in the axilla is a normal response to any vaccine, including COVID or even an infection. The lymph nodes in the body are part of the immune system, and their normal function or manifestation of normal function is swelling. Sometimes after the vaccine, we will actually see the swollen lymph node. So when breast imagers look at the mammogram, we're looking for signs of cancer in the breast and in the armpit. When we see an enlarged lymph node, it could be from any number of causes. Usually it's reactive, reacting to an infection or reacting maybe to a vaccine, but rarely it could be a sign of cancer. So because we're seeing so many instances of swollen lymph nodes in the armpits of women who have had recent COVID-19 vaccines, the Society for Breast Imaging has recommended that women schedule their screening mammogram either before having their first dose of the COVID vaccine or a few weeks after their second dose. This will just avoid the potential for recall for a false positive swollen lymph node. So in a woman who has not had a vaccine and has an abnormality in her breast that's suspicious for breast cancer, or in whom we've diagnosed a breast cancer, a swollen lymph node could be a sign of spread of breast cancer. So in that case, that lymph node might undergo a needle biopsy just to confirm the cause of the swelling of that lymph node. But in the absence of any breast cancer and with the knowledge of medical history of either COVID vaccine or other exposure to which a lymph node might swell, we might either avoid doing a biopsy or put off doing a biopsy until we've had the woman return so we can confirm if it's really an abnormal lymph node. So typically a lymph node will remain swollen for a few days to a few weeks. So if we do observe an abnormal lymph node in a woman who's had a recent COVID-19 vaccine, we may have her return after a month or two for a ultrasound just to confirm that the lymph node is indeed normal. So if we see an abnormal lymph node in a woman without a history of vaccine, we'll look at that lymph node in the context of her entire medical history. Maybe she has some systemic medical issue that's causing lymph nodes to be large. We'll review everything, and if there's no particular cause, there's no etiology, then we will do a biopsy, a needle biopsy of that abnormal lymph node. So for any woman who has a symptom, whether it's focal lump or pain, she should speak to her medical provider and come in for breast imaging as soon as possible. The recommendations to wait for breast imaging either before doing the COVID vaccine or several weeks after having second dose of vaccine really applies to women who are scheduling their screening mammography. So I do want to emphasize that swollen lymph nodes that we see in the axilla are generally benign and reactive. And that's certainly the case in the setting of having had a COVID vaccine. So I also want to just encourage women to schedule that screening mammogram either before the vaccine or a few weeks after the second vaccine to avoid the potential for recall to confirm that the lymph node is indeed normal.